Okay. So what Maria brought up was she brought up the 6 months of the estimation that the doctors have of the 6 months being the expected life expectancy of these people, and I just wanted to bring up that there's 2 doctors that are that make this prognosis and diagnosis that that it will take 6 months approximately. That's the life expectancy. There's a prescribing doctor and there's a consulting doctor, and both of them they work together to minimize the chances of being inaccurate, I guess. They basically they go for the best estimate, and so that's one of the things that the Oregon law does, which is the Death with Dignity Act, that there has to be 2 physicians that agree on such a life expectancy estimation. And she also mentions that that people tend to be irrational and like taking the steps to be euthanized or participating in physician-assisted suicide. And I just want to say that why would you want to stay alive longer in pain and agony for a longer period of time if you are in pain and agony and you are considering euthanasia as an option to end your life? It would be more humane and to participate in physician-assisted suicide, because if you're going to live about longer than 6 months, which is the estimation of the 2 doctors, either way you're still going to be in pain, either emotionally, physically, mentally, and these are factors that greatly tie in to why people get euthanasia in the first place. And so on the regards of people that are in depression, so this is a statistics I found online in an article called Attitudes and Practices of the U.S. Oncologists Regarding Euthanasia, and 22.5% supported the use of physician-assisted suicide for a terminally ill patient with unremitting pain, and these are physicians that are participating in these surveys and oncologists. And 16.5 were personally willing to provide physician-assisted suicide for a patient in excruciating pain. And this is a surprising number, 56.2% actually had requests from patients asking them to participate in physician-assisted suicide. So, and then actually in the clinical practice, 10.8% actually had performed physician-assisted suicide illegally, but in the hopes to end pain. So also just to put things in perspective, 86% of all registered voters publicly supported euthanasia for terminally ill patients. And to basically wrap things up, and why our debate should win, is that euthanasia, physician-assisted suicide should be implemented and legalized because it ends the pain and suffering of many people that are in pain and suffering, but not limited to pain and suffering, more emotional and burdens on their families. We have a great template as a solvency claim. We have a great template of the Oregon law that has been proven to be very effective. The legalization of physician-assisted suicide also opens up more space in hospitals and allows for people that are actually savable to have more attention put towards them, rather than people that want to die in hospitals that are taking up space. And yes, thank you.